Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions on insulin therapeutics. Let's start. Question number 1. A 60-year-old female with type 2 diabetes presents with uncontrolled blood glucose level despite being on appropriate doses of metformin and a sulfonylurea. Her hemoglobin A1C is 9.5%. What is the most appropriate next step in her management? So, this patient is with type 2 diabetes and it is uncontrolled, and she is taking appropriate doses of metformin and sulfonylurea. Hemoglobin A1C is 9.5%. What is the most appropriate next step in her management? A. Increase the sulfonylurea dose. B. Add a peptidase for DPP-4 inhibitor. Initiate insulin therapy. D. Switch to thiazolidinedione. E. Add acarbose. So, what is the answer? Answer is C. Initiate insulin therapy. C is the right choice. Initiate insulin therapy. A 40-year-old male with type 1 diabetes is struggling with postprandial hyperglycemia, especially after evening meals. He is currently on multiple daily injections of insulin. What is the best strategy to address his uncontrolled postprandial glucose level? Choices are: increase the basal insulin dose, add a rapid acting insulin analog before evening meal, switch to a long acting insulin analog, D. Discontinue insulin and start oral anti-diabetic medication, E. Continuous subcutaneous insulin infusion. What is the right choice? This person is struggling with postprandial hyperglycemia, especially after evening meals. He is taking multiple daily injections of insulin. What is the best strategy to address his uncontrolled postprandial glucose level? It is postprandial hyperglycemia. Okay. Choice should be B. Add a rapid acting insulin analog before evening meal. Okay. A rapid acting insulin analog before evening meal. So answer is B. Question number 3. A 25-year-old medical student without a history of diabetes consumes a high carbohydrate meal in an annual feast. What physiological response is expected in terms of insulin secretion? A. Decreased insulin secretion due to increased blood glucose level. B. No change in insulin secretion as a response to a single meal. C. Suppression of insulin secretion to prevent hypoglycemia. D. Increased insulin secretion to promote glucose uptake by the tissues. What is the correct answer? What is the physiological response if a person had a high carbohydrate meal in an annual feast? Answer should be D. Increased insulin secretion. Insulin secretion to promote glucose uptake by the tissues. This is normal physiology. Okay, increase insulin secretion to promote glucose uptake by tissues. Answer is D. D is the answer. Question number 4. A 30-year-old pregnant woman is diagnosed with gestational diabetes during her second trimester. Her blood glucose levels have been elevated and dietary modification alone have not been sufficient to maintain optimal glycemic control. The decision is made to initiate insulin therapy to manage her blood glucose level. Considering the safety of the fetus, which type of insulin is often preferred for managing gestational diabetes? Choices are rapid-acting insulin, B. long-acting basal insulin, C. intermediate-acting insulin, D. premixed insulin. So, this is the condition of gestational diabetes. We always think for the safety of the fetus. So, choice should be B. long-acting basal insulin. Long-acting basal insulin. Okay. Question number 5. A 25-year-old male with a history of type 1 diabetes mellitus presents to the clinic for a routine follow-up. He has been managing his diabetes with multiple daily injections of insulin. Recently, he has noticed episodes of hypoglycemia shortly after meals, despite adhering to his insulin regimen. His current insulin regimen includes long-acting basal insulin and rapid-acting bolus insulin before meals. Which component of the insulin regimen is most likely responsible for episodes of postprandial hypoglycemia? A. rapid-acting bolus insulin, B. long-acting basal insulin, C. intermediate-acting insulin, D. inhaled insulin. Okay, so for this patient, which component of the insulin regimen, he is not getting all the regimens, but which component of the insulin regimen is most likely responsible for episodes of postprandial hypoglycemia? What is the answer? Okay, answer should be A. rapid-acting bolus insulin. A is the answer. Rapid-acting bolus insulin. Question number 6. Insulin resistance is an important association of type 2 diabetes. Each of the oral hypoglycemic drug has unique mode of action. Which of the following drug is the best fit to reduce insulin resistance? Exenatide, glipizide, thiazolidinediones, sulfonylureas, E. alpha glucosidase inhibitors. So our idea is that to choose a drug which is best fit to reduce insulin resistance. Okay, so which oral hypoglycemic drug has unique mode of action? Each of them has unique mode of action. Which of the following drug is best fit to reduce insulin resistance? Answer should be thiazolidinediones. C is the answer. Thiazolidinediones. This is the answer. And that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.